Hello, good morning, Namaskara. I am Dr. Srinivas Reddy, neurosurgeon from the hospitals who operates on the brain and the spine, and a minimal access spine surgeon. Today I am here to share a video about the fractures or about the spine and then the treatment protocols available at present. So what leads to the fractures in the spine? Any trauma, whether it is a trivial or accidents or anything, can lead to the fractures in the spine. So the fractures are more common in the patients who has weak bones. So that can happen secondary to the osteoporosis. In India, the incidence of osteoporosis is around 8 to 10 crores of population, of which 80% of the female who had crossed their menopausal periods. So the osteoporosis is very underdiagnosed and very undertreated in Indian population. Whenever the patient has a trivial fall, they can sustain the fractures anywhere in the body, which can happen more commonly in the spine, that is in the lower back, the hands, anywhere else. The fractures in the lower back can be managed with or without surgically. So those who need surgery may not be needed to open complete back, all these things at present. For a patient who has a wedge compression fractures, like a single vertebral body around the spine has collapsed, then we can do with a minimal invasive procedure where we will introduce a balloon and then we will increase the fracture height and then we will fill it with the bone cement, so that the pain will be completely off immediately after the procedure and the patient can go home in 24 hours. Here I'll show you a small video of the same procedure which we did at the hospitals, Kanakpura Road, Bangalore. This is the spine model which I am carrying now, and so this is the spinal cord. At each segment of the spinal cord we'll have two nerves which comes, one on the right side, one on the left side. So this is the front part and this is the back part. So this is the midline of the spinous process which can be felt over the skin. This is the bone vertebral body which we are speaking about, which can have a wedge compression fractures whenever there is a fall. So and this is the disc in between two vertebral bodies which acts as a cushion whenever you are jumping, driving, two-wheeler, all these things. Now what happens when there is a fracture? So this vertebral body, usually it is in square in shape, that will collapse and it will become like a triangle. So that leads to severe unbearable pain. So where in that kind of situation, what we will do is we will access the vertebral body from behind through here with a small needle at a 5mm stab incision, and then we will dilate the fracture, that is, we will increase the fracture height with a balloon and then we will fill it with the cement, so that the fracture pain will alleviate immediately after the surgery and patient can walk and then go home in 24 hours.